reliable, the footstep thing.
The footstep thing, you can't go wrong.
Okay, it is 9:07. I'm going to call the meeting to order. The agenda was posted, even if we didn't quite know that. They did post it. And so the open meeting laws have been met. We have an agenda that you now have before you. Need a motion to approve.
I'd make that motion.
Okay.
I'll second.
Okay, motion by Krista, second by Barb. Any conversation, discussion, questions? All those in favor of approving the agenda, please say aye. Aye.
Aye.
Aye.
All opposed? Motion to approve is approved. So, approval of minutes from the previous meeting. Those also probably would have come to you most recently. If you've had a chance to look them over, we're looking for a motion to approve the minutes.
I'll make that motion.
We have a second. Okay, I'll go ahead and second it if there's no other second. So, all those in favor of approving the minutes, say aye. Aye.
Aye.
Those opposed? Okay, the minutes are approved. Public health update. Barb.
Well, we sent out a thing late last week. If you want a Janssen and COVID shot, that we are doing them today, just call up, make an appointment. Right here at the health department. Between the education, the shot, and the 15 minutes afterwards should take about a half hour. We are having trouble filling appointments out in the community, and we're currently working at trying to recruit people to come in for shots. We have discontinued the testing with the National Guard. The last one was last week. We do have testing available by appointment with one of our contract nurses. It's just a matter of calling up and setting up an appointment. She's fairly flexible at times, evenings, weekends, things like that. And that's about all I have to say. Where number of cases for positives is way down, which is a good thing. That's all I have for COVID.
Barb, you said that there's openings today?
I think so.
Okay. Is that here or is that over at Independence?
It's here.
Okay.
Dial 225.
Okay.
That's Patty.
Okay. All right. And employees, my understanding of our policy was that employees who wanted to be vaccinated would be allowed to do so middle of the workday without any issue, and that's current policy, correct?
That is
That's
correct.
my understanding.
Yeah, from what I believed, so that the COVID committee had passed acceptable usage of our COVID-19 hours would be for receiving that vaccination.
Okay.
Yeah, the only problem is some people have a reaction afterwards where you're feeling fairly miserable.
Okay.
And I would grant that that would be appropriate usage of COVID time as well, if they did have any side effects from the vaccine.
Okay. All right, then moving on to number 6. That's disaster-related emergency funding. That tends to be what Deb knows most about, so I'll go ahead and hold on to that until she gets here and move on to number 7. Jeremy, you're here, so do you want to weigh in on it?
I know we discussed last week that it's pretty much, our last meeting, that it's pretty much the same thing every time, but this one I just also wanted to give a heads up that I did take that Wisconsin room up front. We transferred that back into a conference room that is eligible for whatever department to reserve, so we got rid of that waiting room that was up there. And then we did change the signage on the doors to the masks are encouraged for this building. Made sure the security guards or the security officers at the front still did have masks, but I still have a pretty good stockpile of everything. We're still continuing on my end of the sanitizing the rooms when we're done and cleaning and you know, door handles and handrails and whatnot. So we're still good on that, but just an update on that room up front since it was discussed at the last meeting.
Okay,
And I still have 8,000 masks in my office if they're needed.
okay. And I believe that the court system has, the Supreme Court, Wisconsin Supreme Court loosened its regulations as of Monday. I know Judge Radke's gone for 2 weeks, but I believe he was anticipating it, so there's probably changes happening there. But yeah, we'll probably still need to keep those masks up front, yeah, until we get a confirmation that masks are no longer required in the courtroom. Okay. Thank you, Jeremy. Then move on to the discussion review of new and existing county-related policies to do with county policies for buildings or for employees. Do we have any new concerns, any new feedback? What are we hearing? What do we know?
I guess I just wanted to get everyone's thoughts. So our COVID hours are set to expire for county employees at the end of June. So I wanted to get kind of some feedback on what this committee was thinking. I know it's obviously personal bargaining's decision at the June meeting, but again, just wanted to get some thoughts.
I'd like to see it go to the end of the year.
Okay. Are you thinking allowing employees to keep that 240 hours, Barb, or lessening that amount, or?
No, just keeping it as is.
Okay.
When is personnel
Or have
bargaining
it.
discussing it?
It will be at, the meeting is a little bit different. Usually it's the third Thursday, but it's actually going to be the fourth Thursday. So it'll be June 24th at 10 a.m. is our next personnel bargaining meeting.
Okay. Do we have an idea of how many hours employees are using right now in average? Or, because I know we had a lot months ago, but.
Right. I don't have the current report right now. I do plan to bring it to the next PB meeting, but it goes anywhere. You know, we have some employees that have no balance left and some employees that have the full 240 hours. So it's kind of a mixed bag.
Okay. Okay, so I suppose this committee probably should look at making some sort of a recommendation. They'll probably be asking
I would
for that.
assume, yeah.
I think they'll probably, I guess one of the questions that I, as a county board member, would have had was obviously the one that I just asked, but then perhaps another one being, do we have any idea what percentage of the employees have, can we even begin, is there even a way to anticipate whether there's going to be a continued need for that amount of hours based on the number of people who have already used them, based on the number of people that we know have been sick, or I suppose there's no real way to do that, or is there?
Not that I can think of off the top of my head. I think it'd be very hard to try and estimate what the need is right now.
And I agree with Krista. You know, we got to get everything opened up. There may still be some parents who are affected by daycare issues. If we get another spike in the fall, depending on who you listen to, Some are saying yes, some are saying no.
When's the next department head meeting?
Tomorrow,
Tomorrow?
It is, yep.
What time tomorrow?
10 a.m. There's a video link if you need to join us.
Okay. Who runs that?
This time it's assigned to Sheriff Semmingson.
And who puts the agenda together? Is this already on the agenda?
They're putting together the agenda today. You could all you need to do is email the sheriff or somebody needs to and say, we want to put this on the agenda.
Okay. I think maybe talking to the department heads to get their input on whether that is a need, because I feel like me making an assessment is doing it from above the boots on the ground
I'll just
level.
say that most of our staff have been vaccinated in human services. All the ones that want to be have had access to that. We have very little use of it, and the only use of it are for people that are chronically struggling with a leave balance.
Okay.
I can email Sheriff and have him add it to the agenda for tomorrow.
Okay, yeah. So I'd like to hear from department heads. If somebody could send me the link to that, I'll go ahead and attend the meeting and explain, what it is that we're looking for feedback on. Because that feels like department heads should be definitely weighing in on that. And then we can advance our opinion on it to the Personnel Bargaining Committee when they consider it. So.
Barb, have all county employees had access to a vaccine if they wanted one?
That's hard to say in terms of the hours for vaccines up to this part. People would have probably had to take time off. So go. We're having
They could
trouble
has COVID time for that. They could
Yeah.
use COVID time for that time off. I mean, have they been told about it? Do they know about it? I mean, has any employee who wants it been prohibited from going to get it, I guess is maybe the question. And if everybody who wants a vaccine gets one, I think that also helps us move towards an answer on this.
My department are all aware of it. In fact, I had one person end up using COVID hours because she was sick as a dog for a couple of days after she got the shot. But as I remember correctly, the COVID hours also included if you had problems with a babysitter related to COVID because they were closed or school was closed or something like that. And I don't know if there's any of that still out there.
Well, we've got about 50 staff in our department, and there hasn't been any we had one where there was exposure last winter at a daycare, but other than that, we haven't had any for our staff. So I think that, again, schools are nearly done for the summer anyway, so that's not going to be an issue. It sounds like in fall, they're all going to be in person going forward. I mean, barring any unforeseen circumstances. And then daycares, I haven't really heard, daycares actually did a lot better than schools since the beginning of COVID and being available. So I haven't heard it. Doesn't mean it's not out there. I just haven't heard it.
Okay. And like I said, I don't know of any way to measure it either. I agree with Krista on that one.
To another vote and undone, so, but I do have concern about the issue that Deb mentioned, which is people who are struggling with leave time anyway, and that's, it's a tough budget, so we want to make sure that we take advantage of every opportunity to be wise with it. Okay, any other thoughts on that? No, I guess turn back on now. Okay, then we will, let's go back to item number 6, discussion and action relating to disaster-related emergency funding. Sources for the county. Deb?
So we talked with Integrity about the American Rescue Act funding that's available. And again, there's several types of funding available through the Rescue Act. There's the 5.75 that's targeted to counties. When we talked with Integrity, and John Austin, County Board Chair, was on the call Monday as well. Integrity, as well as WCA, is strongly recommending that counties figure out, and they can look at how much revenue growth there was for collections and places that we can get money from between 16 and 19 to do an analysis on that, determine your growth rate, apply that to 21 to 20 or 20 to 24, and then what they have been told is most counties should be able to draw down their full allocation just for lost revenues. Then it would go into the general fund, and at that point, the county can use those funds as they see fit. There are no longer any strings on it because the counties receive those funds. They could use it for mitigation, they could use it for a new initiative, they could use it for a building cost, they could use it for anything they want to once it's in the general fund. So right now, Paul is putting together numbers so we can figure out if we can draw down the full or close to the full 575 with that. And then there's also some funding for housing and utilities. And we are working with Integrity to figure out how we can, who do those funds go to in a county? And if it has to be the county, how do we get that out to the people in the community? So I don't have answers on that. We're still studying that information. So that's as best information as I have right now. We did talk at the county board and have the presentation from Integrity. I think we were going to, at our next meeting with the regular meeting with the county board, we'd want them to vote on some sort of a distribution process. But that's as much as I have to talk about right now. I think you probably have a lot of questions.
Anybody have questions?
Sally, do you? You looked like you had thoughts.
Well, I have lots of questions on it, but I know that as we continue to get more information, you know, you're going to get more questions, and so we're kind of at that point. But I guess the question I have is, as we look at the drawing down funds, Paul's working with the various departments. Is it going to be that micro level of where every department's working on it, or
No,
he's just looking at?
He's just looking at the financial reports that he has.
Okay.
I don't know exactly what he's looking at. I need to catch up with him on what that is. And I can bring that back. But I know he's doing he's got all the financials. He's just looking at, WCA recommended you to go look at the time period from 16 to 19, calculate what the growth would have been, then compare 19 to 20, and then any difference, and then apply the growth. And then again, you can apply double the growth in 2021, and then triple the growth in 2022. So, and 4 times the growth in 2024. So when you start to add that up, because this money goes through 2024, we might not get all of it until the end of 2024, depending on how those calculations turn out. But that's the plan right now. That's what we're being advised to do by WCA as well as Integrity.
Okay.
And then again, it goes into the general fund, and then what happens with it from the general fund is really the county board's decision.
You had mentioned things like housing assistance and some of the things that they clearly feel like, and therefore probably are, social services, human services type programs that people are going to be reaching out to your department for information on. Is that already starting to happen?
Not with the housing and the utilities, and it depends on how the state's going to put that money down. That's what we're trying to figure out. Is the state getting it and then sending it to counties? That's what we're trying to figure out. We do know, for example, there's money in there for the home delivered meal program, and we've already gotten some emails from the state about those. They haven't given us an allocation, but they've let us know that they're going to be distributing that out to counties. So that I know we'll be getting, but the other, again, the piece on the housing, I'm still working with Integrity to understand, and the state to figure out how it gets to Trempealeau County.
Okay. Yeah, on my job, somebody called me the other day and was asking about it, and I was a little startled by that, that it was already working its way through the community, and really had no I couldn't even put together much of an answer other than I believe that information is still forthcoming. So that started me wondering, they wanted to know, should we call Human Services? And I thought, oh, I don't know. So, okay.
At the federal level, it's earmarked for housing, for people struggling with housing costs during COVID. And then that's sent to the state, and then how the state gets it to the counties. We're still trying to figure out that conduit. The 575 is basically at the federal level. They already determine the allocation per county. So that's why it's different. That's why we're still trying to figure out how much we get or how it gets to us. Is the county the most proper place to distribute it? Is another organization, maybe Western Dairyland or anybody else, more suited to do that? I just don't have any of those answers for you right now.
Okay. Does anybody else have questions? Okay. Plan over to LEPC. They're going to be working on the continuity of operations, but we still need to get probably have department heads aware that we still need that information. They'll just be sending it to to Dustin, who will then get it to that committee and Schreiner, and so basically what it's going to be looking at is, yes, if a pandemic happens and basically we are again in a place like we were last March, what are the first steps? What are we doing to what policies go into a place, what emergency protocols get activated, all of that, so that we can continue to function as a government. And it should be in such a way that you assume, as department heads or departments, assume that when this comes up again, that you won't be there, so you won't have people who have been through it already there to say, oh, I remember we did it like this. So it needs to be detailed enough that somebody can pick it up and know what to do right away, very turnkey, so to speak. And so that is something also that can be addressed at the department head meeting. But as I said, Schreiner's the one that his committee will now be working on that as part of the larger response plan. Any questions, thoughts? Dustin, you want to weigh in on that?
I don't really have any thoughts on it. Our next meeting is, it's someday in July. I think it's towards the beginning of the month. So if anything can get to us before then, we can start looking at it.
Okay. All right, so tomorrow at department head meeting, we'll be telling everybody to send it to you, right?
So we'll have to add
Yep.
two items. We
Yeah.
should add 2 items to the agenda
Yeah,
then.
so we'll need to add, if that's not on the agenda, then yeah, it needs to be added. Okay, precautions, preventative measures for county facilities and staff. So, we lifted the mask mandate, went to the masks encouraged at your discretion. That's pretty much the only real protocols I think that we've had that have been much of a change. We still should be sanitizing, frequently wiping down no matter what. Does anybody have thoughts or concerns, ideas, input?
The courtrooms also have a sign that says masks are optional at this time. I know when we talked about last time that we were thinking the courtroom still required it, but it says masks optional on the door. I just saw it this morning.
You just saw, okay, yeah, because I know that the Supreme Court, Wisconsin Supreme Court on Monday sent out a revision, but with Judge Radke gone for 2 weeks, I didn't know if they were going to implement it right away, but he had anticipated that. He and I talked last week, so, okay, good. So we know. It's, so that's probably, that's I think that was a large piece of the number of people that were coming in, were those going into the courtroom. Okay. Any other comments on that? Okay. Other COVID-19 related topics for future meetings?
I think it'd be good to hear, get an update, I don't know if it's the next meeting or an upcoming one, to know where are things, I mean, while it's not assigned to us, we certainly have a responsibility to help support this continuity of operations plan. And so are there things that we'd like to know where it's at, and then what's missing, and what can we do to help support that might be helpful.
And the last LAPC meeting that I was at, because I resigned from that committee back in, a couple months ago, so that Schreiner could take it over. At that meeting, he did indicate that this was something that he was working on and wanted department heads to send to them. So, Dustin, have you guys been talking about that at that meeting? You've had like 1 or 2 since then, right? One?
We've had one since then, and it was not mentioned at all during it.
Okay. Okay, yeah, I think they're meeting every other month now, at least through the duration of this. Usually it's a quarterly. But yeah, I'll talk to Schreiner and see if he wants to either pop in and talk about what it is that he's looking for, what he needs and everything, or he can have Dustin speak on his behalf.
I just emailed Sheriff Semmingson about the 2 agenda items for the department head meeting and asked him to send the link for the WebEx to you, Sally.
Okay, thank you. All right. Then, unless there's anything else, our next meeting is Friday, June 11th. Thank you, Samantha.
Would the meeting after that be the 20, oh, never mind, I'll be here, erase that.
Okay, does anybody have concerns about that, June 11th? Okay, June 11th at 9 a.m. I adjourn the meeting. Thank you.